Hey doctors, welcome back to Jab Studies Med Fun, and today we're going to start part 1 for community medicine or PSM. So community medicine or PSM, to be honest, even when I was giving my Fmge exam, it was out of the box. Most of the questions were out of the box, and reality is PSM is actually such of a subject in which you will have many times, even when you will be giving PYQs, you will be like, I had studied the basics which my doctor or sir had asked me to study, and still I was not able to solve some questions. So how do you approach this subject? First of all is we need to know the basics, and let's clear out all the basics. First thing first. Second thing is, whenever you are having any guidelines, make sure that you have the most updated and recent guidelines to follow. Third thing is, at least make sure that you're thorough with the 5 years of Fmge, 5 years of NEET PG and 3 years of INI. Because last year in December, INI questions were straight directly asked, image-based question and all of that. So at least if we are thorough with these topics, we don't have to worry about what is going to come in the examination. Because see, at least your responsibility is to do this much. You have to understand that you don't have to be a master of the subject. You should at least know the basics of all subjects, because you have 19 subjects to complete. So with that due, let's start with PSM part 1. First, let's talk about epidemiology. Now, whenever we talk about epidemiology, remember that in epidemiology, you will have two aspects. One is going to be the studies which are known as observational studies, and one which are interventional studies. So as you know, observation kya matlab? Observation is just to see. So you are not going to do any experiments. You are not going to add anything. You are just observing the data. So observational study is also known as non-experimental studies. While on the other hand, experimental, also known as interventional. As you see, these are synonyms of the same word. Experimental or interventional, now you will be giving some drug, you will be giving some placebo, and then you will observe your data. So remember, epidemiology can be further divided into observational, which is known as non-experimental studies, and then experimental or interventional. Now, if you talk about experimental studies now further can be divided into 3. Now, to do an experiment, either you have to go outside in the field, or you have to come in the clinic, or you have to take the whole community. So that's an easy way to remember. Experimental study, either it can be done in the field, clinic, or you have to take the whole community. All of these 3 things come together, which is known as randomized control trial. If you talk about the observational studies, in observational studies, you have 2 data. One is going to be descriptive data, and then will be analytic. What is descriptive studies? Descriptive studies are done to generate a hypothesis. You have to create a speculation that, okay, this is causing this. So whenever you want to create something, generate a hypothesis, you're going to use a descriptive study. When you want to test the hypothesis, you're going to use an analytical study. So remember one more time, observational and experimental. In observational, you have 2 types of studies. One is going to be descriptive study, and other one is going to be analytical study. Descriptive is done to generate a hypothesis, to make a speculation, while analytical study is used to test the hypothesis. If you talk about descriptive studies, we'll further talk about it. How many types are there? There are 4 types of descriptive studies. Let's talk one by one about it. First will be case study. See, whenever you study also in your examination, what is a case study? Case study is of a single patient. So a hospital story of a single patient. Now this patient, what we are going to ask is, we are going to ask them the history. We are going to ask them what was their past medical history, personal, social history, whatever past drugs they were taking, what is the current diagnosis, treatment, everything will come in case study. So that is the first descriptive study. In descriptive study, you need to understand, this is with respect to time, place, and person. This is going to be your descriptive study. Case series. Now case study was for 1, and case series is going to be for more than 1. And same hospital data of multiple patients, again you're going to do the same thing. You're going to ask the present history, past medical history, personal, social, allergy, whatever is there, and you're collecting the data. That is going to be your case series. So 2 done in case of descriptive. The third one which is going to be there, that is going to be cross-sectional study. What is there in cross-sectional study, guys, is that, for example, this is the population. In the population, we are going to take 1/2 over here. 1/2 or 1/4, whatever you want to call it. You take a quadrant and then you study that population. What is cross-sectional study also known as? These are all PYQs. Cross-sectional study is also known as prevalence study. I'll tell you what is the meaning of prevalence. And it is also known as snapshot of a study, because you're just taking a specific population. So remember, cross-sectional study is also known as prevalence study or snapshot study. What do you do in cross-sectional study? In a cross-sectional study, you start asking questions. Whenever you ask questions or you collect data from every participant about the present, whenever the main thing what you have to take from this line is that you start asking questions that also of the present moment. Whenever you see in the question, they're like, what is the study in which you're asking questions? Your answer is going to be cross-sectional study, prevalence study, or snapshot study. What is prevalence? Prevalence is when you talk about the old cases and the new cases which are coming at the present moment. Prevalence is when you talk about the old cases plus new cases at the present moment. That is the meaning of prevalence. If you talk about only the new cases, that is known as incidence. If you talk about only the new cases which are arising at the present moment, that is known as incidence. Now, as every study has some bias, cross-sectional study also has a bias. Cross-sectional study has a bias which is known as apprehension bias. Now, what is apprehension bias? Is response of a participant changes when they start thinking about the interviewer or other people's opinion. For example, if now I'll ask you, how many of you have had sex? Now, if you just imagine if we were in a whole like in an actual like face-to-face classroom, and I would ask you this question, even though if you might have, or you might if you might have and have multiple partners, you would not tell it you would not tell it loud, because you would be thinking, okay, what will I judge you? Will people judge you? Will people make fun of you? So what was this is, you had a correct answer, but just because you were observing the behavior of the interviewer or the surroundings, that is why you change your answer. So that is called as bias, which is apprehension bias. Apprehension bias is seen in cross-sectional study because you're asking questions. Another example will be white apron hypertension or white coat hypertension. When they are at home, their blood pressure is normal, but all of a sudden when they're going to the hospital, that time the blood pressure is going to raise. So remember what you have to remember in cross-sectional. Let's give a summary. Cross-sectional study is also known as prevalence study. It is also known as snapshot study. What is there in the study? You start asking question of the present time. What is the prevalence study? What is the meaning of prevalence? New cases plus old cases. If you say what is only new cases, that is incidence. Along with this, what is the bias which is seen in cross-sectional study? That is apprehension bias. Next, let's talk about ecological study. So in descriptive, we have already talked about three. One was your case study, case series, and cross-section. Now we're going to talk about ecological studies. Remember guys, ecological study is also known as correlational studies. Now correlation को क्या मतलब होता है? Taking two, comparing this phone with another phone, that is known as correlational study. So that is why, example I will tell you, ecological study का मतलब क्या है कि you have to correlate hospital data with the population data. I'll give you an example. If right now during, just imagine still the COVID times and all, that time we were having quarantine because you know that the COVID-19 the COVID virus was communicable, so person to person transmission हो रहा है. So then you will not ask the people to go outside, but that time you see, because at the time of elections people start having rallies. So when rallies were there, the virus was spreading, and that is why in the hospital there were more registered cases of COVID-19. What I'm trying to say is, whenever because of a public data, because of a public incident, the hospital cases are rising. That is, we are correlating a public event with a hospital data. That is known as ecological study. If I say that people are drinking too much Coca-Cola nowadays, because of drinking too much Coca-Cola, the amount of obesity cases being registered, the amount of diabetes cases being registered in the hospital is high. This is correlation of a public event with the hospital data. That is your ecological study. So ecological study is also known as correlational study. It is when you compare hospital data with the population data. Now remember, very important over here is the unit of study. The unit of study is population. On the other hand, whatever we studied right now, case study, case series, cross-sectional study, all of these three, the unit of study was individual. So make sure you know that in ecological study or correlational study, the unit of study is going to be population. Whereas in case study, case series, and cross-section, the unit of study is individual. No questions are asked from the participant. Where do you ask questions? Very good. In cross-sectional studies. Which similar example which I was giving in 2021 cases, COVID-19 cases rise in Tamil Nadu and West Bengal after the election rally. Why? Because it is communicable. So because of a public event, our hospital data was increasing. So that is why ecological study is also known as correlational study. Similarly, cases of breast cancer increased in USA with increase of fatty diet. So because of a public event, people were eating so much fat that they found out that breast cancer was rising. So this is all about descriptive study. Descriptive study is based on time, place, and person. You have four types of studies: case study, case series, cross-sectional, and ecological study. Now let's talk about analytical study. So analytical study is for to test the hypothesis. Descriptive study was for to generate an hypothesis, right? So analytical study is done to accept or reject an hypothesis. Again, you have 4 types. One is your cross-sectional, ecological, cohort, and case control. So you notice one thing, cross-sectional study and ecological study is in both. It is also in descriptive and it is also in analytical. So remember, what are the analytical study? 4 are there. One is going to be your cross-sectional, ecological, case control, and cohort. So we have already talked about what is cross-sectional. It's the same definition over here also, and ecological. Let's start with a very important topic, that is case control. Now what you have to remember is case control is a backward study. We are going back. So that is why going back is also known as retrospective. What we are doing is that we are going to have a person who is having disease. Let's talk about cancer, lung cancer. So if you are having disease of lung cancer, we are now going back in the past to ask them what were they doing that they got lung cancer. The most common cause of lung cancer is smoking. So if you take smoking over here as a risk factor, so if you notice one thing, what we are doing is we are going from disease to the risk factor. We are going back. Ideally what happens is a person is smoking, then after which he is getting lung cancer, correct? So what we are doing is in case control, we are having person who is having disease and who is not having disease. Then we are asking questions so that we find out that the patient is having risk factor, or the patient did he have the risk factor, or he did not have the risk factor. So basically we are going back. That is why case control is also known as backward study or retrospective study. So remember, we always start with the recruiting disease, presence of disease or non-disease. Let's just take an example of COVID-19. So what happens is we found out, like we took a group of patients and all, we found out there were 100 positive COVID cases and 100 negative cases. Okay. Then after this, we found out what was their history. We took out that they were travel history. So what we did is we started asking them, what was your last contact in the last 5 days? Who you contacted in the last 5 days, because then most probably that was how it was transmitted. So then what they found out was they gave 99 contact history, some gave 40 contact history, which means is right now in this case our disease is COVID and the risk factor is communication, face-to-face contact was there. So that is the risk factor. So you're understanding what is case control. From disease we are going back to find out what was the cause of disease. This is your case control. Now, if I will give you an example of a chart, this chart is very important because it will be useful in case of case control and cohort. Whenever you start about this chart, whenever you make it, see in the vertical side, you remember there should be risk factor positive, risk factor negative. In the horizontal, you will have a patient who is having disease positive and who is having disease negative. So A population is that population who is having the risk factor and who is also having the disease. B is who was exposed to the risk factor but who did not have the disease. C is who had the disease but there is no risk factor. And D is who does not have the disease and who also does not have the risk factor. So remember, A, both positive risk factor, positive disease. B, positive risk factor, no disease. C, positive disease but no risk factor. And D, no disease, no risk factor. Like this you have to remember. So whenever you calculate, in case of case control, the calculation is done with the help of odds ratio. Odds ratio is the ratio which we calculate for case control. And what is this? Chances of disease exposed. Chances of disease in the exposed group, which means chances of disease in the risk factor group. Okay. Which if you will talk about our case, chances of having COVID-19 in those who were having contact divided by chances of having disease in the non-exposed. Let us see this, and this value is, they said, chances of disease in the exposed. So this is A by B, correct? Divide by chances of having disease in the non-exposed. Non-exposed is D. So C by D. This is the basic mathematics. You don't have to remember the full mathematics. Just remember is when you put this up, there will be because of division, there will be cross. The D comes up. Sorry, the D comes up. See, the basic. This is A by B divided by C and D. If you put this up, what happens is A by B times D by C, because the D comes up, right, whenever you bring it with the help of from division to multiplication. So over here you notice one thing, that now what is happening is we are basically cross multiplying. This, if you try to put this in this image over here, we are cross multiplying A into D divided by B into C. So that is why if you see, this is like a cross product. That is why odds ratio is also known as cross product ka ratio. Okay, so this is another PYQ. Odds ratio is also known as cross product. Just to tell you how it is cross product, I gave you that multiplication. Usually they will not ask you questions to calculate. There is not, you don't have that much time over there. Okay, so just remember what is case control. Case control is you start with disease present, disease absent, and you go back to find the risk factor. Okay, how do you calculate? That is odds ratio. Odds ratio is also cross product. What is there? Chances of disease in the exposed divided by chances of disease in the non-exposed. Now, what is the issue with cross product? If you notice one thing with this example, what happened was I took 100 COVID cases and 100 non-COVID cases, and then I asked them, tell me in the last 5 days how many people you met. Now, practically, you cannot remember everyone. If you are a busy person, you will meet 1,000 people, so you cannot remember everyone, right? So that is why in case control, because we have to go back in the past, they have a bias which is known as recall bias. What was the bias in cross-sectional study? That was apprehension bias. That was because you were because of the presence and of an other person, you were changing your answer. In recall biases, you cannot recollect the entire information. That is why the data which is will be collected is not going to be accurate. That is your recall bias. Cases remember past history, but control might forget. Now, one more thing is, okay, if I have COVID-19, I'll be more vigilant. Okay, this is the person I met. This is the person I met. If I am the control, what is the meaning of control? Who does not have the disease, correct? Why will he bother also, and why will he stress too much? I met this guy, this man, because he's completely fine. So that is why this is recall bias. Remember, odds ratio is also cross product ratio. Now, as I told you, case control is backward study. So it is a retrospective or a backward study. Whenever you talked about product, that is going to be your disease. Risk factor can also be known as your exposure. Risk factor can also be known as cause of effect. So these are all synonyms. So remember, case control is going backward. So disease to risk factor. Case control is also known as outcome to exposure. Exposure is the risk factor. Effect is going to be the final product. So effect to cause of effect. These are also the names of case control. So if in the exam they'll ask you like disease to risk factor, what is the calculation? Odds ratio. Outcome to exposure, what is the bias? That is going to be recall bias. Effect to cause, retrospective study, backward study. Everything is going back. From the product, we are going for the main we are going back to the substance. Simple and easy. So this is all about case control. Next, we will be talking about cohort study. Now, since case control was a backward study, from disease we are going to risk factor. In cohort study, we are going to start with risk factor and then we will go to the disease. What I'm trying to say is, take with this example, we are going to take people who are going to smoke and those who don't smoke. And then we are going to wait, we'll have a follow-up study because it is going to take years. And then we will find out that those who had lung cancer and those who did not have lung cancer, you will see that this, those who had lung cancer and those who do not have lung cancer. You notice one thing, I took smoker positive and lung cancer negative, and then those who did not smoke, they got lung cancer. That is life, to be honest. Sometimes things turn around opposite. Anyway, so you understand one thing, what we are going to do is we're going to start with the risk factor. From risk factor, we are going to wait, we're going to follow up. This is also known as prospective. If retrospective means back, prospective means forward. We are going to go from risk factor to disease. We are going to go from cause of effect to the effect. Okay, so remember, from risk factor to the disease. So what we're going to start is, we're going to start with risk factor present and risk factor absent, and then finally we will go to the which is also known as exposure and not, and then finally we will be going to the effect. So over here also what we are going to do is, now in case of cohort, you can find out incidence. As I told you earlier, what was incidence? All the new cases. That is why we are following it. We can get it in cohort, because cohort study is, we are starting from the very basic of risk factor. Then we will be finding out new diseases. That is why in cohort study, you can find out incidence. So now, what will be the calculation? In case control, we were finding out odds ratio. In cohort, we are going to find something which is known as relative risk or risk ratio. What is this? It is the incidence of disease in exposed. Incidence is new cases in the total cases, right? So what you're going to do is, same example of here, new cases in the total cases. So means it is A by A plus B. So means new cases in all cases. And then after this, we are going to divide it by presence of disease in the non-exposed. So presence of disease. So it is C. C divided by non-exposed. These are the whole non-exposed column, right? So you guys at least know by this. This is the column of who is having disease. This is the column who is not having disease. This is the column where there is exposure, risk factor is there, and this is here. This is the column where there is non-risk factor. So what I said is the relative risk is equal to incidence of disease divided by who are exposed, A plus B, divided by incidence of disease in the non-exposed, C plus D. So this is the formula for relative risk. What was the formula for for your odds ratio? It was a cross product. What was the cross product? A D B into C, right? So this was the formula. So make sure you know. They might ask you like this: identify the formula. Maybe maximum this they will be there. Just remember that you have to add the both disease in case of incidence, because in incidence formation of new cases in the total population. So this is all what you have to remember with respect to relative risk. In cohort, you can find another thing which is your attributable risk. In layman terms, if I tell you what is attributable risk, that single risk factor, how much responsibility is that of how much responsibility the single risk factor has to cause the disease, that is known as attributable risk. This is just to make you understand what is, for example, in case of lung cancer, there are multiple causes. Smoking can be there, environment can be there, what type of occupation do you do, that is also there. So for example, in attributable risk, where for smoking is how much responsibility of smoking is there to cause lung cancer, that can be calculated with this formula, which is your attributable risk. Now, what is the formula for attributable risk? You have to remember that attributable risk is equal to incidence of exposed minus incidence of non-exposed divided by incidence of exposed. You have to remember this into 100. Very important is into 100. So what is the, remember, just by hearted now only. Incidence of exposed minus incidence of non-exposed divided by exposed. Simple. One exposed down, one exposed one exposed up, one exposed down, minus the non-exposed. That is your attributable risk. Now, whenever you want to talk about public health concern, whenever you're talking about public health data, disease, that time now you need something which is known as population attributable risk. The only difference between the formula, they will only ask you the formula, okay? How do you differentiate attributable risk and population? In attributable risk, now you remember you have by-hearted incidence in exposed minus non-exposed divided by exposed. In population attributable risk, that exposed word is there, right? This exposed word, just change this into population. So what is going to be then? Incidence in population minus incidence in non-exposed divided by incidence in population. So the only difference, if you notice one thing, and how you remember, it's also very easy. In attributable risk, it is exposed. P for population, and over here exposed को change कर लो आप population से. So that is very easy. So what is attributable risk? Incidence in exposed minus non-exposed divided by exposed. Population attributable risk is incidence in population minus incidence in non-exposed divided by incidence in population. That is only what you have to remember in attributable risk and population attributable risk. So finally, cohort study, what I told you is we are going to go front. We are going to have disease, example, we are going to have, risk factors, smoking present, smoking not. And then we will wait for someone to develop cancer. So for example, this is going to be known as cohort study, follow-up study, because you are waiting, following up every time, ki haan, hua ki nahi, like that. Prospective study, forward study, longitudinal study. Just remember this also another word, longitudinal study. Incidence study. Why? Because we are getting new cases. So incidence study, exposure to outcome, risk factor to disease, cause to disease. Remember in case control it was ulta. We were going for disease to risk factor. I hope you understood this. So always at start we are going to do with exposure and non-exposure. This is the basic part of cohort study. Now in cohort you will further divide, further subdivision. You have multiple types of cohort. One type is known as retrospective cohort or historical cohort. Now retrospective, which means going back. History also means going back. So why are we going back in cohort study when this is a prospective study? Retrospective cohort means what is, if we have some data, let us imagine some data with respect to radiologists who are very commonly exposed to radiation, the chances of getting testicular cancer. If I want to study about that, maybe there was a data where some other researchers, some other doctors collected a data in 2015, and that data they did a cohort study. Now if I want to find out and make a data out of those old datas, means already done study, I'm just going to take that data from the past. That is known as retrospective or historical data. Just read it out, you'll understand nicely. No personal questions are asked. Two groups are compared based on written records or work recorded data. So in this example, we're taking testicular cancer, work record of last 10 years, radiological staff, is said to have 1.1 times more risk of testicular cancer as compared to others. So basically, I hope you understood. For today's data, I'm going to go from a data which has already made in the past. For example, 2015, they also did like a cohort and they found out this data, and this data I'm just stating in my research. That is why in this research, going back, that is known as retrospective or historical cohort. Another PYQ and PSM they can ask is with respect to radiation. So radiological question is thickness of lid apron. Now because we're talking about radiation, thickness of lid apron, how much it should be? Remember, it should be by 0.5 mm. Multiple times they have asked this question, so make sure you know this. Thickness of the lid apron is 0.5 mm. Next, so now we are done with retrospective and prospective. So retrospective and historical. There is another one which is known as mixed cohort, ambispective and nested case control. So now by mixed, what do you mean? A mixture of front and back. So we are having a prospective data also, prospective cohort, and we are also having a retrospective cohort. These are all synonyms: mixed cohort, ambispective, nested case control. These all mean the same. So what we are doing is we took the past data. Let's take the testicular cancer example only. We took the past data. I am adding to that to my research, and I am now further continuing the data by having a follow-up study. So now, example, my friend X, he was doing this data. I took his data also, and now I am also continuing a cohort. I am also finding out what are the values. So using a back data and then continuing the forward data. So you're using back plus front. That is why this is mixed cohort, also known as ambispective, also known as nested case control. Along with the past written records, future follow-up also is done. So then same example which I used with the testicular cancer. This is a combination of retrospective data and prospective data. So what is this? This is your mixed ambispective nested case control. To remember what we have talked about cohort is, just remember RH positive man. With remember RH, that is retrospective and historical. So these both are backward cohorts, where MAN, RH positive man, M will be mixed, A will be ambispective, and N is nested case control. So that's how you can remember. These are all the same names. Okay? Now, whenever I will ask you odds ratio, that is case control. Whenever I'll ask you RR, relative risk, that is your cohort. Till that you guys already know. Whenever you see odds ratio or risk ratio, we are trying to find out the relation of the risk factor with the disease. Whenever you have a value which is more than 1, any value which is more than 1, that means you have a positive association or causative association, which means this risk factor is responsible for this disease. Any value which is plus 1, 1.1, 1.2, 1.3, 1.4. If your odds ratio or relative risk ratio is less than 1, okay, remember less than 1, not 0, less than 1, it is trying to say that we are having a negative value or a protective association. Whenever you are saying a negative value or protective association, which means is what we are trying to find out now, they are trying to say that by what risk factor you are saying is causing this disease, this risk factor is actually protecting you from causing this disease. It is preventing the disease. That is why the value is less than 1. So remember, whenever your odds ratio or risk ratio is less than 1, this is your protective association or negative association, which means the risk factor which you thought is responsible for the disease, it is your data, your study is only ulta pulta. This is actually protecting you to avoid the disease. While if the value is more than 1 is your like a causative association, positive association, which means this risk factor is responsible for causing the disease. Okay, so remember more than 1 and less than 1. Finally, we'll start a question and see one more question I want to answer is if your value is 0, RR value 0, that does not mean it is nothing. It is less than 1 only, right? So means this is your negative association or it is a protective association. 0 does not mean 0 over here. Over here, 0 in RR and in odds ratio, 0, the value which means nothing is 1. If your, I'll just write it down here, relative risk and odds ratio, if it is 1, it means there is no association. There is no relation between the risk factor and disease. Okay. If RR and odds ratio or odds ratio is more than 1, that means it is responsible. This is positive association. Okay. Positive, which means it is the one which is the risk factor is causing. So this is causative association. And if it is less than 1, Then this is your protective, which means your risk factor which you're thinking that it is causing the disease, it's not causing the disease, it is helping you to prevent the disease. So finally, let's start with some questions and then you will understand all what we have blabbered right now. So in a case control study, so whenever you start a question, you do like this. In a case control study, which means what is my starting denominators? It is going to be disease present and disease negative, right? Always we start with this. So in a case control studies, ALL patient of pediatric, that is acute lymphoblastic leukemia patients are there, is taken as case. So what will be the control? What they're trying to say is we are having ALL patient as disease. So what will be the disease, non-disease? Those the patients who are not having ALL absent patient, which means ALL the patients who are normal in the pediatric case. So let us find out. They're asking us, we have the case, so who should we take as control? Question number 1, ALL present? No, we already have the disease. We need to have a disease negative. So ALL present people, that is the answer is removed. Then ALL absent patient of pediatric OPD and ALL patient of village area. Now who will you choose? For any research to make sense, the population should be a similar type. If I am taking data of a hospital and I am making a research, my control also should be of the hospital. If I am taking a data of a village, it should not be an urban area population, means if I want to correlate and make some value. So it should be that also for village data. So in case control, we have something which is known as matching. Matching means our case and our control should make sense. They should be of the same population. So first two answers are not right because we already have the cases. The control should be those who don't have disease. So what is our question is, our case is pediatric ward, which means the hospital patients. So among C and D, now which will you choose? Obviously you will choose pediatric OPD. So your answer is C. So what will be our control in this case? ALL absent patients of pediatric OPD. I hope you understood. Next question. Skipping breakfast is said to be associated with gastritis. Now skipping breakfast over here is the risk factor. Yes. And gastritis over here is the disease. Okay. Next. In a study, participants taking regular breakfast, which means study taking regular breakfast, RS risk factor is positive, having gastritis, is compared with participants who are not taking breakfast, which means risk factor positive and risk factor negative. So which means is we are starting right now with risk factor positive and then risk factor negative. So if you are starting with risk factor positive and risk factor negative, what will be your answer? Correct. It is going to be your cohort study. Cohort study, which means we start with risk factor and then we find out the disease. Whereas in case control, you start with disease and then you go back to find the risk factor. Next question. Regular exercise is associated with low blood pressure. So low blood pressure over here is the disease and regular exercise is your risk factor. In a study, participants having hypertension is compared with without hypertension. So disease positive and disease negative in terms of their exercise habit. What is this study? So you're starting with disease positive and then you're and disease negative. What is your answer? Very good. It is going to be case control. I hope with these three questions you have understood what we are talking about, case control and cohort. Finally, to summarize, whenever you have a question, see, if they're going to start with disease positive and disease negative, that question is related to case control. What was the bias in case control? That was recall bias, right? Cohort study. In cohort study, remember you start with the risk factor positive, risk factor negative. That is your exposure. Whenever you compare hospital data with population data, that is your ecological studies. Whenever you ask questions and with respect to the present situation, that is your cross-sectional study, also known as prevalence study, also known as snapshot study. Finally, another study which is there, that is known as posological study. Posological, P for posological, P for pediatrics. So whenever you study about drug dosing related to pediatrics, that is known as posological study. This was one PYQ, so that's why I added. So finally, make sure you always read this and then you start your day. I hope you understood the part 1 of PSM. PSM is this, that it takes some time to grasp. So make sure you read it one more time. I'm trying to make it as simple as possible. And if you like my videos, make sure you share it, help and aware other people, because our funda is simple. We are going to try to make you, definitely you're going to pass, but we're going to make that thing in free. Okay. If you have any other doubts, feel free to DM me. I'll always try to reply to your messages, and let us meet in the next video. Take care. Bye bye.